Well, welcome. I'm Janine Caudill, and I'm a registered nurse, and I've been teaching first aid for 20 years, a variety of different settings and professionals and daycare, preschool, as she said. And today, we're going to be talking about the basics of first aid so that you can add that to your other knowledge. Now, I know that and when you work in a healthcare facility or community or just whatever, you have your own guidelines and protocol and policies and procedures that you've got to follow. But this is just a little extra. You always follow your own policies and procedures if it's a little different than what I'm going to tell you today. But this also will help you in your home or out in the community. Any place you are, you'll have the basics of first aid in case you need to use them. All right? Okay, so let's go ahead and get started. The course goal is to assist participants to recognize, assess, and appropriately treat traumatic and medical emergencies. Sometimes when we think about first aid, we only think about bleeding and things like that. Well, there are a lot of medical situations also that we're going to cover today that are emergencies. And I'm sure you've had some experiences with those working with your people here at your facility, community. So we're going to talk about both. Well, let's look at what is an emergency. Some things are, some things aren't. So when we look at emergencies, we're looking for things that we need to act very quickly, and that is things like if there's no breathing, no pulse, of course, severe bleeding, unconsciousness, injuries, and medical emergencies such as diabetes. So that's also an emergency if you have someone in trouble with medical conditions, and of course we can't list every one of them here. The course goal then is to help you, as I mentioned before, in all of those situations, have a little more knowledge of what to do. Well, let's talk about severity for a little bit. And if you think about if you're caring for a child, everything is a crisis. But in our situation, we're looking at things that are life-threatening, things that are going to lead to dying. And then if it's not that much of a crisis, if you need medical attention now, you may still need to call a squad, call EMS. It's all an assessment. You have to decide. And of course, you have, when you're working, you have other people that will help you make those decisions. All right? And then, of course, can be managed with first aid. We can clean it off, put a bandage on it, reassure the person, but we don't have to call the squad. So we don't want to call if we don't have to. But here again, that might be one place where your community or facility says we always call for any kind of situation that we think needs to be called, even though it's not life-threatening, it's not any of those other things. So here again, if you are supposed to call, then this might be a little different than what you would think. So remember, quick action can prevent a more serious situation or condition. If you let it go, it could just get worse. And all of you have had experiences with that, I'm sure, or heard of experiences where you didn't go to the emergency room when you should have, or didn't treat something when you should have, and the person went downhill, and it just got worse. So when do you call the EMS? Well, this is the standard. If someone is unconscious, semi-conscious, or confused, not breathing, of course, breathing is very important, difficulty breathing or choking, no pulse, of course, all these things we know we would call the squad for. We can't take care of everything because of a lot of reasons. We don't have the equipment, we don't have the expertise, we need some help, all right? Bleeding that won't stop, we're gonna do our best to make it stop, but if it doesn't, we need to call. Coughing and vomiting blood. Now when you get right about here, we've got a little bit more time, unless this is extreme bleeding and vomiting, coughing up a lot of blood. That doesn't happen very often, but if it does, then it gets up into this category. Poisoning, some poisons act very slowly, and every poison is different. If someone comes in contact with poison or some way, by mouth, etc., it's going to act different, and it may be slow, all right? If someone has a seizure for the first time, remember a first-time seizure can be anything from a teenage girl with a change in hormones to a brain tumor. We don't know that. There's a lot of situations where you can have a seizure. We need to find out the cause. Or if it lasts longer than 5 minutes. A seizure that lasts longer than 5 minutes can lead to some brain damage and some other problems. So those are two things with seizures, and we'll talk more about that in a little bit. Sudden severe pain, nobody really should have sudden severe pain. It needs to be checked out. And injuries that may leave the person permanently disabled. For example, a compound fracture of a leg or something like that that's going to be really difficult to fix, and it's got a long time recuperating. We can't do that ourselves. If the condition could get could worsen or become life-threatening, right? You got to be savvy enough to pick up on that. Can this lead to something that's going to cause them to die? And there have been some situations where this happened, where people thought everything was okay, we'll just watch it, treat it in the usual way, and the person died. So you've got to be smart about looking for conditions that could go worse. Moving the person could cause further damage, which would be head, back, neck injuries, falls, and I'm sure you deal with that here. And it needs special equipment. There's things we don't have here. Okay? So, our primary survey, and if you've had CPR, you know that this is basically the same thing. What we're going to do is always look at the scene, no matter where you are. If there's electricity around, wires that are down, you're going to survey that scene, because if you go ahead and treat that person, you could be in trouble too. Many people have been killed getting out of their car to help other people. So always be very careful about that. And the first thing you do is survey the scene for things like smoke, whatever, electricity. Someone who's drowned. Don't get drowned yourself trying to take care of that person. So we're always going to check the scene. Remain calm. All right, now that's hard for a lot of people. I hear that all the time. I can't look at blood, I can't see blood. Well, then you're the one that goes and calls 911. You're the one that goes and gets the supervisor, or just whoever it is. You might also pull out the first aid kit and do that kind of thing. So if you've got help, and in a facility or a community, you usually have helpers, workers that work with you. Let them take care of it if it doesn't bother them, and you go do the other things. Because there's many people who just the sight of blood can pass out, all right? Don't be ashamed of that, it just happens. So now we're going to check the consciousness. Now that we know the scene is safe, we can approach that person. We're going to give them a shake on the shoulders. And if they don't respond, we know they're unconscious. They're unresponsive. Anytime you have an unresponsive person, you call a squad because there's a reason for it. It could be a head injury, or it could be something like hypoglycemia, where blood sugar drops down below 40. People can die in those situations. And it has happened at night when no one heard them or knew what was happening. Okay? So something like that. Now, when we find out they're unconscious, we tell someone, go call the squad, get the AED if you have one, get the first aid kit, just whatever your equipment is. And then when you have injuries, you're going to look further for those things. Consciousness can be due to a lot of things. Unconsciousness. Illness, severe infection, shock from blood loss, fluid loss, injuries. We'll talk more about shock. Poisoning, severe allergic reactions, diabetic reactions, heat exhaustion, or hypothermia. All of these things can cause unconsciousness. And there's no way you could put the whole list on there. So there's a lot of things. Call 911 if unconscious, check for breathing and heartbeat then. You recognize those steps if you've had CPR. Survey the scene, check for responsiveness. Call 911. Go back and take 5 to 10 seconds to see what is wrong with them. Up till that point, you don't know. You don't automatically start CPR or start assuming anything. We don't diagnose, we just try to take care of people in the moment. We're going to leave that to somebody else, but we do the best we can. When we check for breathing and heartbeat, if we don't have those things, we're going to start CPR immediately. Then we're going to check for bleeding. I get the question occasionally, well, what if you're the only one there and there's bleeding and they need CPR? Well, do the best you can, is all I can say, because it's hard. But they need oxygen first. If you don't have oxygen, brain death occurs in 3 to 5 minutes. That's not very long. And every minute after that 5 minutes, you lose 10% of your brain function. So we got to work quickly. So they need oxygen most of all. Then if they're breathing and they've got a heartbeat, check for diabetic jewelry or other kinds of jewelry. Also, if you have a person that you're taking care of here, you have some records on them and you know your people who are here. You know if they've got diabetes or just whatever it is. But sometimes when you have that kind of situation, you also have information on, do they have a blood meter? Of course, you probably have those here. But, you know, just what do they have? They might have a tube of glucose for hypoglycemia, things like that. So you know your patients, you know what's going on with them, and that's another big tip. Look for changes, no matter what's going on. All right? Now remember, two of the things you need to remember most of all is, first of all, do no harm. We do not want to make this situation worse. All right? For example, if you have a broken bone or an arm that looks crooked, you can't say, here, I'll straighten that out for you. You know, things like that. We don't want to make it worse. We want to make it better, or at least keep it stable till somebody else can make it better. And then we do not give victims anything to eat or drink if they've got a problem until we know what it is. If it's a broken bone, like a compound fracture, they're gonna have to have surgery. When you give somebody food or water, you can delay that surgery for as much as 24 hours because an anesthesiologist will not operate on somebody that has eaten or drank. Remember, if you've ever had surgery, you know you have to be without food or water after midnight, and sometimes even earlier. So we don't do that except for if we have a conscious diabetic victim or emergency medicine. Those are the only things we do until we find out whether it's okay, until the doctor says it's okay. Remember, people are going to ask you for water, ask you for ice, ask you for things, and you just have to tell them, no, we can't do that right now until we know what's going on. That's your best response. We don't want to make it worse. So if we check this person and we feel like they've got a pulse and they're breathing, then we can go on to what else is wrong. If they're conscious, you can ask them what happened. And they'll tell you if they're, coherent and not confused, like they've hit their head or something. Ask the bystanders, does their breathing seem normal? Look at their color. Color changes. It's really unusual, the different colors people can turn. Waxy, blue, red, bright red when someone's choking and they don't have oxygen. So check their color. Is it pale? Is it gray looking? As a healthcare worker, I know you are able to, in a crowd, see somebody who looks pretty gray and you think, they must have a heart problem or something. But look at their color and you can tell that something is wrong. Then we're going to look from top to bottom. We're not going to push on anything. We're not going to press on anything. We can make it worse. All right? Move quickly from head to toe. Look for bleeding, cuts, swelling, bruises. Check the head, face, ears, nose, and mouth. Check the shoulders, chest, stomach, and back. Remember, people can have internal injuries, and they're bleeding inside, just as dangerous as having a wound that you can see where you're bleeding outside. Check the arms, hands, legs, feet. We're just moving down to see what's going on. We have to find out. Here again, we're not diagnosing. We're looking for things that we can treat ourselves, that we can make better or stable until help comes. Okay, let's talk about infection control for a little bit. I'm sure you've had plenty of information on that. But here's another area where you want to protect yourself and you want to protect them. We do something like universal precautions. We always put on our gloves if we think we're going to come in contact with any kind of body fluid. Doesn't matter what it is. One of my programs for preschool says you only have to wear your gloves if you can see blood in the body fluid. Well, I don't want to do all those other things that you guys do without having my gloves on. So that's universal precautions. We don't pick and choose. You put your gloves on. You never know. All right? And if you have protective glasses in your first aid kit and you've got a really bad situation, it's always a good idea to put those on too. And remember about washing hands before and after. If you've ever looked at a box of gloves, 100 gloves, maybe 200 gloves, you can't tell me all of those are perfect. So don't depend on that glove to totally protect you. Always wash your hands afterwards. And I'm a firm believer in warm soap, warm water and soap, and nice sudsy water to get your hands clean. Clean under your fingernails, you never know. When you use hand sanitizer, if you've watched people do that, they do this kind of thing. Fingernails can carry a lot of stuff underneath them, all right? Remember, you have staph on your hands all the time, on your body, and the oil that holds it to your body, you can wash off with the soap and water. So I'm a firm believer in hand washing, unless you don't have anything else to use. And then your hand sanitizer is sufficient for that, but not the best. Right? Now, remember that, I don't know who would do this, don't put on your lipstick while you're giving first aid. Remember that your eyes, your nose, your mouth are lined with mucous membrane. And you can absorb things through those membranes. That's why we can give a person a nitroglycerin tablet, put it under their tongue, and it'll help stop chest pain. That's why suppositories work, is because they're absorbed quickly through the mucous membrane. So if you get exposed in any of those areas, you've got to take steps to protect yourself. Hand washing, eye rinsing, to get whatever it is out of your eye. If you've got something in your mouth, rinse your mouth. And then you need to tell your supervisor. Anytime you have been exposed to any kind of body fluid, you need to report it and do an incident report. You have the right to know the results of any test that that person would go through. I have a nursing director once that did CPR on the dean of OSU and requested that he had testing for HIV and hepatitis. You have the right to know the results to that test, all right, if you get exposed. Now, you've got to use common sense with that. How much was it? Whatever. But go to your supervisor and tell her. Any questions? Oh, you can write your questions down on your cards. Let's talk about them. Let's talk about some things that happen. Shock is caused by any situation that decreases the amount of oxygen or glucose to the brain. Those are the two things the brain absolutely has to have. Right? Or any threat to the neurological system, such as brain injury, spine injury, neck injury. The body doesn't take kindly to that, and the brain doesn't like it at all. And people can go in shock just from hearing that a loved one has died. It's more like fainting. But shock is something you have to watch for. It can happen with almost any situation. But these are the main underlying things that are going on in the body. The brain isn't getting what it needs. The things that can cause shock are cardiac arrest, cardiac shock, stroke, internal and external blood loss. Now remember, anytime that blood is outside of the veins and arteries and capillaries, doesn't matter whether it's inside and it's not bleeding out where you can see it. It could be swelling. Remember, swelling is blood and fluid being someplace where it's not supposed to be. And when you take enough fluid away from the circulatory system, it can't carry enough red blood cells to the brain to make it happy. So that's why shock happens. Other situations, here again, fluid loss. Fluid loss from anywhere. Throwing up, diarrhea, you can get dehydration and loss of electrolytes. Brain or spinal cord injuries, as I mentioned before, that's neurological shock. Severe allergic reaction, that's anaphylactic shock. You've heard all of these terms. Severe infection, septic shock. A lot of times people die when they get sepsis, septic shock. Poisoning or drug overdose, and hypoglycemia, that's diabetic shock. Okay, there's a lot of reasons why it can happen. Now what are the signs? And you can look at these signs and tell how they affect the brain. Confusion, agitation, restlessness, what's happening, we don't have enough oxygen to the brain, okay? Lightheadedness, sleepiness, all of these things. If you've had patients or persons in your community that have COPD, it's like being a fish out of water, and you feel agitated. If you've ever had a bad cold and had to sleep sitting up because you couldn't get enough oxygen, that's the way you feel. People will tell you, you need to get some rest. Well, you don't rest well until you're better. That's just, it doesn't make sense, because you can't relax, you don't have enough air, and all of a sudden when you get better you think, man, I was really sick. But that's lack of oxygen. Severe pain, swelling, and redness, heat, if you can feel heat, those are all due to loss of blood, whether it's internal or external. And let's say you sprain your ankle, the fluid collects there. Something's happened to cause fluid to leak out of the circulatory system, and that's what causes the severe pain, swelling, all of those things. Now, weakness would be because of lack of oxygen. Nausea and vomiting with neurological things, very common. Bump on the head, a concussion, you get nauseated. Pale, cool, clammy skin, and when I say cool, I mean ice cold. If you have somebody whose skin starts feeling just really icy, but they're still sweating, that's pale and cool. Shock with a heart attack, stroke, injuries. You start feeling, you just get that. Anyone who's ever had that, and then you start feeling like you're going to pass out. And it's simply because the brain is saying, lay down so I can get the blood out of your legs to my head. A lot of blood in the large part of your body, in your legs. And when you lay down, the brain gets that. That's why it's telling you, lay down. That's why you faint. That's why you tell people put their head between their knees if they feel lightheaded, is to get some more blood to the brain. Now we're going to put our gloves on. Anytime we're taking care of a person, we don't know what's happening. Have the person lie down and standing. If they're still alert, have them lay down, because who knows, they may pass out at any time. Be better to be down. Plus they can get the oxygen to their brain. Loose and tight clothing. Keep them warm but not hot. Do CPR if you need to. And here again, don't give anything by mouth except emergencies meds if they're conscious, or if it's something external like an EpiPen. And don't move that person if you suspect that there's a head, neck, back injuries, unless there's an absolute danger to them, all right? Because we can do so much more damage. Remember, you can have a vertebrae fracture without having paralysis. But if you would happen to move this person and it cuts into the spinal cord, that's when you can run into all those other things like I said, paralysis and other symptoms, maybe life-threatening and also lifelong disability. So don't move them. If a person has had a fall, leave them right where they are. Don't try to tell them to get up or anything like that. Just leave them lay until you can get some help for them. Now let's look at some medical emergencies, as I mentioned. Of course, we can never put them all down there. And believe me, every time you have a situation, it's going to be completely different. There's never going to be two times when the thing that's happening is the same. So you can take first aid classes, you can think about it, you can talk about it, but there's always going to be something that you have to improvise or whatever. All right? So, Sudden cardiac arrest, remember that doesn't mean necessarily heart attack. There's a lot of reasons why people have cardiac arrest. For example, being electrocuted can stop your heart when it's not a heart attack, but it could be. Stroke, breathing problems, diabetes, seizures. These are all things that can lead to a crisis situation. Let's talk about cardiac arrest, since it does happen a lot. Actually, those numbers are going down nationwide, the deaths from cardiac arrest. Good medicine, good treatment quickly. Remember the golden hour. If you have someone who's having a stroke or a heart attack, you need to get them to the hospital within an hour. That's when the medication that will break up a clot, if that's the problem, they can give it within an hour and help to reduce the symptoms. So the symptoms include unconsciousness, no breathing, no heartbeat, maybe gasping. This is cardiac arrest. Those will be the general overall symptoms. Call the squad, start CPR. So if we talk about heart attack causing the cardiac arrest, it could be either due to a clot or bleeding of some kind, anything that would cause muscle to die in the heart. Symptoms, persistent pain. Remember, with a heart attack, you never know for sure. They may not have many symptoms at all, except lack of oxygen, they're not getting enough air. Typical symptoms are maybe putting their arms out and yawning, things like that. You wouldn't think of a heart attack when they're doing it over and over again. They're pale probably. So one of the things that, a lot of people get this kind of stuff from stomach problems. They had something that they ate and they've got stomach pain really, it radiates to the chest. But if you look for the difficulty breathing, that's one of the big symptoms, because remember, part of the heart muscle has died and the heart's not working correctly. Persistent pain, heaviness, discomfort in the chest, pain in either or, even the right arm. Heard of patients doing that. Right here under your chin, there's a little groove right here. And for some reason, heart attack patients have pain right there. Fingertips on your left hand, perhaps. Shortness of breath always. Pale skin, cool, clammy skin. Sweating, maybe nauseated and vomiting. The very first thing they're going to say to you is, I'm not having a heart attack. And they're going to refuse to go to the hospital. This can't be happening. I'm not having a heart attack. Well, you have to recognize that and get them help before it gets worse, within that hour. Call 911, get the person to sit down or lie down, remove tight clothing, give them adult aspirin or 2 baby aspirins if they're not allergic. There is chewable adult aspirin now to put in first aid kits or in your supply of medicine. Start CPR if you have to. See, people aren't always unconscious when they're having a heart attack, and we want to get it taken care of then. The other thing you shouldn't do is put someone who's having a heart attack in your own car and try to take them. And unless the squad can't get there, let's say you live way out in the country and it's a volunteer squad, then you do it. But otherwise, if you're driving and someone starts to go bad on you, your focus is on that person instead of your driving. And it can be very dangerous. And stroke is basically the same thing. You either have a clot or you have bleeding, just like heart attack with the blood clot. Causes damage to brain cells and nerves. It depends on what part of the brain. The symptoms are going to be whatever's affected here. Everybody's brain is different. When you have brain surgery, they do brain mapping, to decide where to make the incision. because it could affect your speech center, or it could affect your ability to do numbers. And remember, brain is fascinating. Everybody is just a little bit different. So these are the things that you look for. And fast is a good mnemonic. Face, drooping to one side or numbness. A is arm weakness or numbness. S is speech, slurred speech. T is time to call 911. Okay? Do it quickly. Now let's look at some breathing emergencies. Of course, you can imagine these things all would cause you to have problems breathing. Electric shock can actually stop your heart. Remember, the heart is an electrical muscle. And when you interrupt that flow of electricity, you can stop the heart. So there's a lot of things: asthma, poisoning, allergic reactions. I have asthma. There are some things that I instantly cannot breathe when I come in contact with it. One of those places is the Estee Lauder perfume counter, for example. I don't go there, but there are some things that instantly I can't breathe. Can't speak, cough, or breathe. There's wheezing, because asthma is famous for that. Coughing is also can be a preface to asthma, an asthma attack coming on, kind of a dry cough. Flaring nostrils, this is a real phenomenon that happens. The nostrils flare so that you can get more oxygen in. You ever seen a racehorse that's racing? Their nostrils would be really big, and you can't control that. You have nothing to do with that. But a person who's having an asthmatic attack, this is one of the things that occur. Clutching their throat while gestures, blueness. With choking, I've seen people turn bright red. Excessive drooling. When you can't breathe, a lot of times if there's something blocking, we have a lot of saliva. It doesn't go down. It has to come out. Sitting up, leaning forward. You probably have patients that you take care of that they have to have their head up a little bit or they can't rest. Head bobbing with each breath, common among little kids trying to breathe. And of course, when you don't have enough oxygen, you're going to lose consciousness. Now, when someone's getting some air, shout for help, send someone to call EMS, stay calm, allow them to choose whatever position they want to be in, whatever works for them. Stay with the victim, and it might develop into a situation where you had to start CPR. Okay? Now, if we have a pulse but we don't have any breathing, that can happen. Send someone to call 911. Remember, if we don't get this straightened out, in that 3 to 5 minutes, brain death is going to start occurring, right? Tilt the head back, check for breathing. This is our old CPR stuff. If no breathing but pulse is present, give one breath every 5 seconds. You have to have 8 breaths in a minute to survive. This would be 12. Use your mask, unless it's a family member or something like that. If breath does not go in, reposition the head and try it again. Give just enough breath to make the chest rise. We don't want to overdo breaths. Check for pulse every minute. Eventually the heart's going to stop because it's not getting any oxygen. Then you're going to have to start CPR. Choking, and when you had CPR class, they talk about choking. If this person is conscious, remember, we're always going to ask them, can I help you? I know the Heimlich. Can I help you? And if they say no, you know, they signal no, that they're trying to get it out. They may not. They may be embarrassed, who knows. But just stand by. Don't leave them. If they agree for help, stand behind them, make it's like a spool of thread. And you put the end of that spool of thread here, right above the navel. There's a little bone here we don't want to break off. And you do 5 upward thrusts. Thrust and release. We're trying to use that pressure to get it out. I've seen piece of chicken fly clear across the room. Not with the first thrust, but with the second one. Okay? So we're going to do 5 thrusts, check the person's consciousness. Remember, we're behind them. Continue until it's coughed up or until the person becomes unconscious. Now, I'm not going to wait too long to call the squad. If we've been doing, remember that 3 to 5 minutes? If we've been doing this a while and it's not straightening that person out, even before they go unconscious, I'm going to have someone call the squad. Or I'm going to whip out my cell phone and call the squad. Just whatever. With an unconscious adult, then we're going to help them to the floor, open the airway, see if there's something there. We do not do a finger sweep on anybody anymore, regardless, even adults, because probably too many bad things have happened. People puncturing tissue or just whatever. If they're not breathing and don't have a pulse and still, we are going to start chest compressions. And every time we come up to give our breath, we're going to check for anything that's in the mouth. And then we're just going to continue until the squad gets there. Okay, let's talk about diabetes. Now, hyperglycemia is more of a chronic situation. We're not too concerned about that, other than we need to get them a plan to get their blood sugar down. It's not exactly a crisis situation. It's a chronic crisis situation. But someone with hypoglycemia, as I mentioned, can die if their blood sugar drops below 40. Now, what are we going to start seeing with this person? Sudden changes in hunger. Have you ever been just really hungry and you just feel crabby about it because you've had to go without eating? Irritability, feeling upset. No, what's happening? The brain isn't getting enough glucose. All right? Now, the reason for that, usually hypoglycemic and diabetic, is remember they need glucose. The brain cells and muscle cells need glucose to live, to survive, to function. But you have to have insulin, and it is the key that allows the glucose to get into the brain cell. Without insulin, it'll be floating around in the bloodstream, and that's where you get hyperglycemia. Well, let's say we have somebody who we've given their regular insulin to, because we planned on them eating breakfast, lunch, maybe a snack in between, and they haven't done it. They haven't felt real well, or they didn't like the food. So now the insulin has caused all of the glucose in the bloodstream to go to the brain, go to the muscles, and we've run out. There's no more glucose in the bloodstream to use because we had too much insulin. Okay? So that's when things start dropping. And you know your patients. You know who has diabetes. When you start seeing these kind of things, I've seen patients when I come on to work at 3 to 11 that no one could stand. They would be yelling and crabby and whatever. They found out that they were diabetic once they start giving them a snack about 2 o'clock. Nicest person in the world. Before, no one could stand them and could hardly go take care of them. But they figured out that they needed a snack because their blood sugar dropped. So this is some of the things that you'll see. And then with diabetic shock, remember, these are some of the symptoms of that. Feeling shaky, trembly. We want to catch this here. If somebody isn't acting normal, that's when you want to be Johnny on the spot and realize they're a diabetic, something's going on. So we need to give them help. Paleness, cramping, confusion, brain's not happy, and seizures or unconsciousness. We're at the point there where we can't give them something by mouth if it goes too far. All right, so what are we going to do? Check the blood sugar level. You have meters in your facilities. A conscious victim, we can give glucose to, orange juice, or regular soda, no diet things there, and even add some sugar. They may have a tube of glucose. Icing is perfect. You know, they have things to decorate with that are, it's pure sugar. If you run into a bind and you don't have something else. I have a friend who gives her husband sugar packets when they're flying on the plane. The only thing wrong with just plain sugar, it's easy to inhale because sometimes it kind of would choke you or whatever. Hard candy I wouldn't do because they can choke on that. And then you've got another problem on your hand. Okay. Is that good enough? Absolutely not. Because what's going to happen? If they have a lot of insulin, it's going to drop again. So just this isn't good enough. We have got to give them some more complex carbohydrates to keep them going. In fact, OSU uses milk as their first line of defense because it has sugar in it, lactose. Anything that ends in OSE is a sugar. Not only has sugar, but it has protein and carbohydrates in it that the body has to work a little harder to process, but it lasts longer. And then you're going to have to look at their plan and say, hey, this just isn't working. We need to do some different snacks, different meals, cut down on the insulin, whatever you have to do to make their plan work for them. And some people are very, what they call brittle, where it doesn't take much to send them over the edge. Now, if they're unconscious, if they get to that place, if you do this kind of thing in your facility, in your healthcare facility, you can administer IV glucose or call the squad if you don't. They'll bring a bag of IV glucose and they'll hook them right up, and usually that'll start bringing people around. All right? Okay. Now let's discuss seizures just a little bit. People have sometimes petit mal seizures, they call them, when they just kind of stare at you. You think they're not paying attention, but they really are having a mini seizure. If you see that happening, you need to let your supervisor know, let the doctor know, whatever. And then we have grand mal seizures, which most of us are more familiar with. And seizures can happen for a lot of reasons. Unusual behavior, sometimes you have this, and sometimes you don't. I've been in a situation where I was talking to somebody 1 second, the next second he was on the floor. And he was about 6'2". I mean, it was here and then there on the floor. No prefacing, no signs or symptoms. We were just talking. Down he went. So, staring with twitching of arms and legs, general jerking motions is what we think of as a seizure, foaming from the mouth, and unconsciousness. Here's some of the reasons why we have seizures: head injury, poisoning, diabetes, dehydration, epilepsy, heat exhaustion, heat stroke, high fever and illness. This can happen as a child, and they may have seizures from then on, but it's not the typical epilepsy. But we have to take care of this before it gets to the place where you have febrile seizures. So these are some of the reasons why you can have seizures. first of all, we're just going to assist that person to the floor if they aren't already there. Provide privacy. If you're having a seizure, you don't want everybody standing around. And this goes for a lot of things. Sometimes you'll have 40 people respond to some sort of code. Used to happen in the hospital, and so only the people who are taking care of the person need to be there. Everybody else should be off taking care of the other patients, but everybody's always interested. I had a friend whose mother had coded on a corner in New York City, and of course they took her shirt off and her bra and everything, and the woman I was talking to said my mother would have been mortified because there must have been 400 people standing around looking at her bare chest. So provide privacy. The other thing that happens with seizure victims is they often wet their pants because of the relaxation of all neural control. That's embarrassing. Now, we're not going to try to restrict them. That's old. We're going to clear the area around them so that they don't get injured. Don't put anything in their mouth. This is also old. They might bite their tongue, they might bite their cheek. You can take care of that later. You cannot swallow your tongue. Now what can happen is it can relax if they're laying on their back and block their airway. In that case, you're going to put them on their side. Don't restrain them and time the seizure. As I mentioned, if it goes over 5 minutes, even if they've had frequent seizures, they need to be, you need to call a squad. They need to be at the hospital. Turn them on the side. They could have fluids in their mouth. We don't want them to aspirate those. Start CPR if you have to. That usually doesn't happen. Now this person is going to have to go home, or if it's someone who's mobile, they're going to want to sleep. If they don't go to the emergency room, which usually happens, they're going to feel terrible. Headache, tired, sleepy. They need to rest. They're not going to be able to continue doing what they were doing. Any questions? Oh, well, we'll follow that up later. It's on the camera. Okay. I'm so used to saying that. Now let's go on to some injury situations where we need to do emergency care. For bleeding, let's say someone falls and they've got bleeding someplace. What we're going to do is, first of all, get some help, but then we're going to take a gauze pad, put it on the injury, apply pressure until we see that the wound has stopped bleeding, and then we're going to put roller gauze on it to hold it tight, and then we're going to give the person help. If it continues to bleed through that pad, we're going to add another one. We're not going to take this one off because it's probably started to clot underneath, and you'll break up that clot and you'll have to start all over again. Sometimes it can take up to 15 minutes. Now today there's a lot of people on blood thinners, all right? So you may have to be holding that for a while. You can also elevate it. Let's say it's an arm. That'll slow down the blood flow to the area. Bandage the wound, but do not cut off circulation. When you put that gauze on there, we want it so that it won't slip up and down, but we also don't want to cut off blood to the rest of the hand. If bleeding can't be controlled, and this happens sometimes, you can call the squad. Now, for nosebleeds, I just want to mention that we don't tilt the head backwards. This is a common misunderstanding. You don't want to put your head back because the blood goes down the back of your throat. You can aspirate it into your lungs or into your stomach, and maybe throw up and then aspirate that. So you lean forward, and then you put pressure on the nose. If they're capable to do it themselves, let them do it. But if this is a person that's unconscious or whatever, you need to do it for them. You can put an ice pack on the nose to help stop the bleeding. If bleeding doesn't stop in 15 minutes, seek medical care. And if it happens frequently, this person probably needs to be seen by a doctor because it could be a clotting disorder or something. Now, and you know, we have nosebleeds sometimes for no reason, but if it keeps happening, it could be a situation where they need to have blood tests and things. It needs to be reported to their doctor. Okay, now when we talk about bleeding, and we can't get it stopped, we'll talk about a tourniquet just for a minute. For a long time, they've said no tourniquets at all because too many things happen. Remember, let's say you've got a wound here, you put a tourniquet on the arm, you're cutting the blood circulation off to that arm. So think about that, because this area will turn gray from lack of blood. You might lose the rest of this arm. And that's probably what happened when they said, don't use tourniquets anymore. Because with the public, they didn't know how to do it. All right? So, if you can't get the bleeding stopped, for example, with an amputation, if you can't get the bleeding stopped, you know that you've got a serious problem, the person's going to die. If you don't get the bleeding stopped quickly, use a tourniquet only then. And when you use a tourniquet, you use something that's wide, a belt, something that have you ever had blood drawn and they use those little rubber things and they wrap all up so it feels like a really big rubber band and it hurts? We don't want that. We want something wide. There are commercial tourniquets that, for example, people who work in buckets, trimming trees and things with a saw, you can imagine what could happen if they would drop that chainsaw in the bucket. So they have big wide tourniquets for thighs, whatever. But only use it if you think it's absolutely necessary. It is not a first line of defense. Putting pressure on it and elevating is the best. What we do is put it on, tighten it, don't take it off. Years ago they said, put it on 20 minutes, take it off. Or loosen it up, let some blood flow into the limb. Now we just mark the time, date and time, and do not remove the tourniquet, let the squad take care of that, or the emergency room. Now, if we've got an amputated part, let's say it's a finger, rinse the detached part, put it in a plastic bag, tie the bag, and then put it in a container of ice and water and send to the hospital with the person. We never put anything directly on ice. We never put an ice pack directly on skin because it can destroy tissues. All right? You put something underneath it. Now, the other thing you want to check, don't use terry cloth, because if you feel underneath, you can't feel the cool. The best thing is tea towels. I know a lot of people probably may not know what a tea towel is, but it's a thinner type of dishcloth or dish towel that's thin enough that you can feel the ice. Now your commercial ice packs already have cloth on them, so you don't have to worry about that one. So, but don't put it directly on ice. And that's why we put it in a bag first and then ice and water. Maybe it can be reattached. There's been a lot of situations today. I mean, they're doing marvelous things where that's been able. Head, neck, and back injuries, we do not want to move this person unless we absolutely have to. And probably in a building with healthcare building, you wouldn't have to move somebody. You remember, when we're talking about first aid, especially injuries, we're talking about one person. You could have a situation where, God forbid, you had a tornado or something else. Keep in mind that you could have more than one victim, and you might have to move this person away from downed electrical wires or water or smoke. So you need to do that. Any fall, anytime you've been hit on the head, anytime you've been in a car crash or being hit by a car, any of those things where you could get thrown and have a head injury, neck injury, back injury, we certainly don't want to make that worse, and it could happen. The other thing with neck injuries and head injuries, you could have bleeding inside and not know it. Here again, remember, this is neurological shock, unconsciousness, confusion, remember the lack of oxygen, but this is more than that, very dangerous. Unequal pupils, neck pain, headache, a lot of times there's vomiting when you affect the head. And if you have a seizure without a history of seizure, severe bleeding, this is very dangerous. What's happened here is the lining around the meninges, around the spinal cord and brain has been punctured some way or cut. And that's spinal fluid. It can be tinged with pink, it can be bright red, but anytime you have bleeding from the ears, that should never happen. Any kind of fluid from the ears or nose, you can't stop it. You can't just wipe it away and it'll go away, all right? I know a person that took a year to recover from that kind of head injuries because they had to learn to walk all over and extensive rehab. And no feeling or numbness, of course, that would mean that you've got neurological damage. When you do have a head injury, or if they're on the floor, wherever they are, you're going to have to, if they're not able themselves to support the head, keep them from moving forward, backward, either way, because that could sever the spinal cord or cause injury to it. So you want to support their head. If it's an adult and they're alert, pretty much they'll stay down and stay still. Remember, the first thing people want to do is get up, and that's not a good idea until things are checked out. All right. And when the squad comes, they'll be bringing a backboard, neck brace, whatever, to keep everything stable. And this just gives you some ideas of when to move people in immediate danger. If you have to do CPR and the person's laying on their stomach or side, get a bunch of people to help you. So that when you're rolling that person over, everything is supported, all in a line, all right? Now let's look at muscle and bone injuries. Now the reason you have all four of these is because you've got blood someplace where it's not supposed to be. It's outside of the circulatory system and it's causing swelling. That swelling is pressing against nerves. The person may be cradling the injured part, and if you have deformities, compound fractures, that's really dangerous. If you have a break when everything is still aligned, it's probably going to heal. Any of these other things where things are poking through the skin, whatever, you're going to have surgery, and maybe pins and things like that. Check for other injuries. If you have a compound fracture, you can't put pressure on the wound that's maybe bleeding. You're going to have to put pressure around the wound, and including on the head. You could have a skull fracture and have bone fragments sticking up, but bleeding, you would have to put pressure around because you sure don't want to put it on there. Do not move the injured part. For strains and brains, you want to look down, this is a good mnemonic if you want to remember that, or algorithm, whatever you want to call it, and it is rice. What you need to do is rest whatever part it is, put an ice pack on it for 20 minutes and off for 20 minutes. Do not put it directly on the skin. What you're doing with ice is stopping the bleeding, or cutting down on it. That stops the pain. That stops the swelling. In 48 to 72 hours, then you can put some heat on it, and what that does is increase the healing. It brings blood to the situation. Compression with ACE bandage. So we're also helping with the swelling, and elevate it above the heart. People will elevate things, but it has to be above the heart. Laying down with your leg up, put your arm up. Elevation helps with swelling. Eye injuries, call the squad anytime you have an injury to the eye. Eyes are very, very important. We don't want anything to happen to them. If something's penetrated the eye, do not take it out. You know, other than a speck of dust or something like that. But if the eyeball has been punctured, a lot of times that, and leaks, if you take it out, it'll leak, and a lot of times that won't regenerate, you'll lose that eyeball. Chemicals in the eye, flush the eye for 30 minutes, 20 to 30 minutes. Very hard to do. I've done that myself, and the eye doesn't like it because the eyes are used to normal saline, and plain water doesn't hurt them, but it's just very hard to do. Be sure you put the eye that's bad on the bottom so you're not washing stuff into the good eye. Human and animal bites, sometimes healthcare workers get bitten, and the human mouth is not very clean. I've seen wounds where, usually bar fights, they don't come when they get bitten, but they come three days later to the emergency room, and every bite, tooth mark, will be infected. Okay, so it is a danger. If you get bit, be sure you clean it very well with soap and water. If the skin is broken, you've got to be worried about bloodborne pathogens, exposure to it. We usually don't worry about rabies with people, but if you get bitten by an animal, which probably isn't going to happen here in the healthcare facility, but these are the things that can carry rabies. Seek medical care for any kind of animal bite, especially snake bites. I don't know about you, but I don't know what's really poisonous and what isn't. So it's always good to seek help. And remember, anytime you have a snake bite, you call poison control. And this is the number. Call the EMS if it's large or gaping, or bleeding is uncontrolled, and then contact the health department. That dog or whatever is going to have to be tested. The tricky thing is the rabies shots have to be started within 2 weeks. The test that they do on the dogs doesn't come back for 2 weeks. So, you know, got to act quickly. One other thing I want to say, if you have gaping or a wound, or even if when you're talking about an injury where there's a wound, you need to get that wound stitched, if it needs stitches, within 4 hours. Because what happens is the edges of the wound start to die, and then they don't have tissue to stitch to. So then you have to have a bigger wound, bigger scar. So if you can't make the decision to go, you know, think about it, do it before 4 hours goes by. Now, insect bites, I just want to throw in here because we have some real problems now with insect bites. Different things, diseases that keep cropping up. Ticks, remember, if you have a tick on you, use tweezers. Forget about all those old things with lit matches and whatever. But use tweezers, just pull it till it tense, the tweezers on the tick, and they'll let go, all right? You have several ticks that are dangerous. I'll show you a picture of one. Today, the Lyme tick, deer tick, can spread Lyme disease. Used to be on the eastern coast, and now it's everywhere. That's very dangerous. Sometimes people have problems the rest of their lives. So if you don't recognize it, you might not get care quickly enough. All right. Save your tick. You can even put it in the freezer. So if you start developing some symptoms that are kind of strange, you can take it to the health department. They like to know that because they like to track down where you got the tick and so on and so forth. Even the dog tick today can be dangerous. It spreads Rocky Mountain spotted fever. We don't think about the big dog tick that does that, but there's even diseases that are spread by our common ticks. So there's all kinds of things you can do to protect yourself from ticks. Bees and wasps, the main problem would be if you're really allergic to it, you'd have to have an EpiPen, keep it on hand. If not, call the squad if people start having problems. And this can happen maybe an hour or even 2 hours after you actually get stung. So if someone has a bee sting, keep an eye on them. With the honeybee, you have to get that stinger out because it loses the stinger. Use a credit card, you sweep it off, wash it really well, because it'll keep injecting toxin as long as it's in your skin. Other things like yellow jackets, they can sting numerous times without losing your stinger. Spiders, wash the area. If it's a black widow, you need to go to the hospital. Black widows spread systemically, which means all over the body, and you can die from that. A brown recluse is localized. It's a bad bite. If you ever want to see some of the brown recluse bites, get online and Google it. Not pleasant stuff. But here they are, in case you don't know what they look like. Isn't that pleasant? This is the deer tick. Notice its legs. You can't see it. They look segmented, but they're actually striped. And they're little tiny. Even when they're engorged, they're not very big. And they like to embed themselves under the skin. So you may not, if it's in your hair, you may not even notice it right away. The black widow spider is the one that you can die from. Brown recluse, this is the one that I would worry more about because they're in your basements, your garage, your wood piles, any place where they can kind of hide. But you can be cleaning out the basement, get bit on the hands. There's no tissue on the hands, basically. What happens is a spider injects an enzyme, and that enzyme digests the tissue so that it can come back later and eat whatever it was. Spider or a fly, another spider, whatever. Okay. Not so dangerous as far as losing your life, but not pleasant either. Dental emergencies, if you lose a permanent tooth, don't try to reinsert it. That used to be the thing. So you try to put it back in. We're not doing that. Can you imagine someone even letting you do that? Because whatever amount of tooth you have outside the gum, that's how big the root is above the gum. So what we do is clean it off. We're going to put it in something, either normal saline or milk. Take it to the emergency room. They always have a dentist on call. Chipped teeth, there's not anything you can do for that. And I mentioned before that poisoning, the symptoms from poisoning can be entirely different because they affect different parts of the body. Could be the respiratory center. And what that's gonna do is your respirations, you know, when people take an overdose of sleeping pills on purpose, what happens is the respiratory center is affected and their breathing gets slower and slower and slower until, remember, you have to have 8 breaths to support life. There's all kinds of things that you can be exposed to. Cleaning solutions, when we're using some pretty strong things to clean. Street drugs, we've had 7,000 little kids last year that were exposed to street drugs in their own home who ended up in the emergency room. And I wouldn't be surprised if that's not more. So be very careful with that situation. Don't ever do CPR without a mask. Medication overdoses. This is one thing that could happen in a healthcare facility. We give twice the dose because we thought it hasn't been given before, wasn't documented. We go ahead and give it again, and now you've got a poison situation. And each symptom is different, or each poison is different. Pain, difficulty breathing, slowing pulse, sweating, dizziness, fainting, unconsciousness, and seizures can happen. Do CPR if you need to, use the mask, don't expose yourself. Also gloves, if there's some chemical involved, you don't want to be exposed to it too. Put your gloves on. Call poison control, they're wonderful. Ours, it's a nationwide number, no matter where you are, it just goes to different centers. Ours is Children's Hospital. They will call you the next day, they will check on you even later if they think it's serious enough. They'll tell you whether to go to the emergency room or not, if it's serious enough. We don't give Epicac anymore. If you have it in your cabinet, pretty much get rid of it, because if this is a caustic thing that people have swallowed, when you make them, it burns going down, you make them throw up, it burns coming up. Rarely is poison control going to tell you to use Epicac. Call the squad if necessary. Burns, 3-degree of burns. Some of the newer programs say small burn, large burn. That's pretty, subjective. But 1st degree is sunburn. It's always a good example. 2nd degree, there's blisters. Remember, we don't ever break any blisters because there's sterile fluid inside there. It's helping the skin to mend. So don't do that. Now, if they break on their own, remember that's exposure because your protection has been taken off of the body. This one needs attention if it's large. 3rd degree burn would be something like a house fire, where people were on fire or involved with that. And this is what happens. Because this type of burn is very deep, down into the muscles even. All right? For chemical burns, you need to call poison control. Now, what I want to say is an overall view of burns. The thing to do is cool it down. Even if you got a burn on your hand from taking the cookies out, put it in a bowl of cool water and leave it there longer than what you think until it stops hurting. And the reason for that is when you have a burn, the tissue underneath is still being damaged as long as it hurts. So leave it in the cool water. We tend to, cool a little bit and take it out. If it still hurts, and you have to have patience. Same way with any type of burn, cool the person off. 3rd degree burns are a little different. If you have clothing, get it off, unless you can't. If it's stuck to the skin, leave it, because this person's going to end up in the burn unit. Any jewelry you need to take off if you can. If the fingers are already swollen or whatever, don't do it. Just leave it, don't cut it off. And remember, contact lenses are plus. They can melt. So you need to get them out if you can. If you can't, leave them. Electrical burns, of course, the first thing you have to do is get the electricity turned on. If you're out in the community and there's wires involved, let's say a car, you're going to have to wait till the electric company comes, because you can't do anything or you can get electrocuted. You might need to do CPR. And remember that when you have someone who's been burned, there's an entry wound and an exit wound. The exit wound could be worse than the entry wound. If you, for example, get shocked here, that can go through your heart and stop the heart. Sometimes it'll start on your own, or you might need to do CPR. And when you're putting dressings on wounds that are burned, always use the slick, non-stick bandages. The original brand was Telfa, but now almost every, even Walmart puts out non-stick bandages. Those are nice to use even for children because they don't stick. Chemical burns, brush chemicals off of the skin with your gloves on before you put water on it, because water a lot of times will make chemical burn worse. So, all those things we said we were going to do, flush the eyes, whatever, depends on what's going on. Okay, heat exhaustion. Some of the symptoms are heavy sweating, fatigue, headache, nausea, thirst, heat cramps, dizziness, vomiting. Once you've been exposed to heat and you have this kind of thing happen, you can't tolerate the sun anymore. You can't go to a ball game and sit out in the sun because you'll start getting sick. So, remove clothing. The object here is to cool people off. Remember, we don't put ice directly on the skin. We can, if they're alert, we can cool them inside and outside with beverages. Call the squad if they get worse, which can lead to heat stroke. You can die from heat stroke. You can have unresponsiveness. Call the squad, start CPR, move the person to a cool area, take off outer clothes, quickly cool them off with sponging or spraying. Place ice packs inside the neck, armpits, and groin. And then there's the opposite of that is hypothermia. And situations where an elder has wandered outside and gotten locked out, and they, of course, would suffer in the winter, would suffer from hypothermia, shivering that's uncontrollable, and then it may stop. Lethargy, pale, cool skin, even under their clothing, and changes in responsiveness. Of course, get them out of the cold, take off wet clothing. You know, you can have hypothermia when the temperature isn't even low, if you're wet. That's a reminder about little kids. You know, those nice gloves you can buy for $1, that's great, but if they get wet, you can have hypothermia on the hands and even frostbite. And little kids aren't going to come in when they're playing in the snow. So you need to be careful with those gloves. Hypothermia, we want to get them warm, just like we cooled them off when they were too hot. No alcohol, and we're not going to use extreme heat, of course. If they're unresponsive, call EMS, start CPR. Frostbite, the skin looks waxy, gray, white, yellow, feels numb, achy, or tingly, may become painless. Remember, this is because it's deep down and the tissue's dead. You're losing that tissue. Might feel hard to touch. Now the problem is, If you get them inside, if it thaws out and then refreezes some way, that's causing major damage. They're probably gonna lose those toes or those fingers. Sometimes ears are also frostbite to the place, frostbitten to the place where you're going to have them removed. We're going to do the same thing, get them warm. The armpits are a great place to put things. Of course, you're not going to do that with the patient unless you put them in their own armpits. But little kids, it's a good place to warm up hands. Only lukewarm water. Protect the area because you can do more damage. And put gauze between fingers or toes to protect them from rubbing. And of course, this is an emergency call. No friction. You know, sometimes we like to rub things like this, that can damage tissue. Okay. To end the program, I just want to remind you, keep victims and yourself safe. Do not give victim food or water, and give only emergency meds as needed. Bottom line is, do no harm. Don't make the situation worse than it already is.